you had some news over the weekend with Cigna and Humana. You both announced a new policy so talk to us about your announcement this weekend.
Yeah, well, we announced that we're eliminating all cost sharing, deductibles, copays, coinsurance for the treatment of COVID-19. The argument is that at a time where there is incredible anxiety and stress, both in terms of our economic stability and in terms of our health, the last thing we want is for anyone to be worried about their finances when they're combating this disease. We wanted to take that issue, that financial issue, off the table. So by doing this, we now have fully covered the testing, the services around the testing, and now all the services around treatment. So at least we have removed finances from the list of concerns for our members in the setting of this pandemic.
Man, thank you so much for that. That feels like a really very powerful statement from both of your companies to say it's so important to go out and get tested, because knowing your status is a huge part of stemming the spread.
Yeah, that's right. So we know that people avoid treatment, avoid testing because of the finances.
Mm-hmm.
And that is bad for our members, but it's also bad for society at a time where we really need more information and we really need to be able to identify and appropriately manage those who are infected.
Well, thank you for that, because it goes right into our next question, which is, so many of us who are lucky enough to have insurance know that you have to stay in network. And so my next question is, how are you guys managing, church parking lots and drive-throughs as in network?
Yeah. No, it's a really good question. It's particularly poignant at a time where, as our other guests have been noting, are challenges around access. There aren't enough tests for everyone. And it is our obligation as a payer to make sure that our patients, our members, have access to the tests they need. So if there are no in-network tests available, then we have to make it available. We have to make out-of-network tests available for our members as well. And in those settings, we are still offering, we are covering with and waiving all co-payments, co-insurance, and deductibles, so that, again, the finances should not be any impediment to people getting tested.
Understood. Thank you for that. Speaking of other things that insurance companies are doing, and especially you guys, we were talking about telemedicine availability. If we're supposed to stay home, people are nervous about going into hospitals or even minute clinics because that's obviously where other sick people are, or other people with other problems. So talk to us about telemedicine availability and coverage.
So I'm glad you brought it up. I think it may end up being, telemedicine may be one of the really transformative pieces of our healthcare system throughout this pandemic. We know that if we have a patient or a member who is potentially infected but not that sick, the last place we want them to go is to a clinical setting where they're going to be exposed to others, potentially expose others to their illness if they have it, or if they don't have it, to be exposed to others and potentially contract the illness. The goal is to keep folks with coronavirus isolated and separated. So staying away from clinical settings is so critical. So we've offered a number of approaches to try to make telehealth more available. We have vendors for each of our main products that can serve as an urgent care resource, MD Live and Doc on Demand. But more importantly, we've opened up the opportunity for everyone's doctor, a primary care doctor, a specialist, a behavioral health physician, to call their patients just using a cell phone. We will pay the provider the full cost that they would have charged us had it been a face-to-face visit, and we are eliminating all cost sharing for our members. The rationale here, again, is that we have a role to play by leveraging the right set of financial incentives and policies to keep our members safe and at home, and to reduce the spread of the disease. And telehealth, we think, is a really critical way. It's interesting to note, though, that if you look at the most progressive primary care practices that we work with, primary care practices that focus on vulnerable elderly and have developed more progressive care management policies, we're seeing that they're reporting on average that about 90 to 95% of their visits now are being conducted via telehealth. 4 months
Wow,
ago, the answer that number was 0.
wow,
We're
so that is
really
that is a
seeing a
huge
rapid
change.
transformation. It's a huge change.
So I do want to, and I know this is a lot of, is this an industry-wide goal? Like, are you seeing your peer companies make these kinds of pivots or talk about these kinds of pivots?
Yeah, I mean, we are certainly not alone. We all recognize that there's a clear set of guiding principles here that says, let's keep patients away from providers, let's keep patients away from other patients, let's minimize the spread of disease. The rationale for using telehealth is entirely straightforward. But it will be interesting because I'm not sure we're going to end up returning to, the status quo pre-coronavirus after we've learned the value of this patient-centered, convenient, new way of delivering medicine.
Hey, thanks for watching. If you like this video, check out these other videos from USA Today to stay up to date with all the latest news.